This segment is brought to you by Busamed Hillcrest Private Hospital, proudly rated as one of the top 20 hospitals in South Africa for the 5th consecutive year by members of South Africa's largest medical aid, Discovery Health. Deafness is usually the result of inner ear or nerve damage. It may be caused by a congenital defect, injury, disease, certain medication, exposure to loud noises, or age-related wear and tear.
Doctor, thank you for joining us on Living Your Best Life.
Thank you very much for having me. It's a pleasure to be here.
With all the advancement in technology that's helping people with their hearing, I think the most important thing is to actually understand how hearing works.
Sure. It'll be my pleasure to explain a bit of the miracle of hearing and the miracle that is the human ear, and how it is that we can hear such a wide frequency of hearing. Essentially, sound travels in waves in air, and it will travel along and then be collected by the outer ear, pass along the ear canal onto the drum. And the ear can be divided into an outer, a middle, and an inner ear. And in the outer ear, the sound waves, as I mentioned, will be collected by the eardrum and then be passed along a little chain of bones in the middle ear. The hammer, anvil, and stirrup, as depicted here, both on the picture and in these little models. The sound vibrations are then passed along this chain of bones to the inner ear, or the cochlea. Now, the cochlea is a snail-shaped organ that is fluid-filled, and that it contains 20,000 little hair cells which collect the sound vibrations and then translate those vibrations into electrical stimulation that run along nerve cells to the brain. That'll then be interpreted as sound. Now, the 20,000 hair cells are arranged like the keys of a piano, with the low frequencies right at the top of the apex of that snail shell and the high frequencies right at the bottom. We are able to hear from 20 Hertz to 20,000 Hertz so that we can hear music, orchestra, and speech. Because it is fluid-filled and we have this inner ear organ, we need something to be able to translate the sound that is traveling in air into something to travel in water. Because if you think about it practically, if you're swimming underwater and somebody's speaking to you from the top, the sound will just mostly bounce off the surface and you won't be able to hear. So that's why we need these three little bones and the system that is the miracle of the middle ear. And so really that's the system of how hearing should normally work. And part of that, because this middle ear is a box that is filled with air, that pressure needs to be equalized. So the air pressure is the same in the middle ear and in the outer ear. And we do that, a critical part of that is your own pressure equalization tube, or the eustachian tube, that connects to the back of the nose. Now, that's something that happens subconsciously and automatically that normally you're not aware of until either you fly or you have the flu, and then you need to suddenly equalize that pressure. It's quite complex, but essentially it will open when you swallow and then equalize the pressure, and that's quite critical to that process too, so that the sound waves can then pass across and go across to the inner ear.
Let's talk about the advancement in technology.
What I'd like to start with is if we go back to our outer ear problem. So let's say you're born without an outer ear or an ear canal. Now you can't use the conventional ear canal and this drum and bridge to conduct the sound to the inner ear. So if there's a problem there, you end up with what we call a conductive hearing loss. So what you can do is you can then put the sound waves into the bone of the skull directly, and those sound waves can then pass directly to the cochlea or the inner ear, and hence the bone conduction implant. So here are a couple examples. One, this is a bone conduction implant from the company Cochlear, and what you have is a really state-of-the-art little hearing aid like this, and this connects to a little titanium implant that is inserted into the skull, and the hearing aid clips on there like that. This can connect wirelessly to your phone, so you can stream your telephone to it, your iTunes and music, and then the sound is transferred, as I said, straight to your cochlear inner ear, giving you crystal clear sound. So you don't even have to have an outer ear, an ear canal. There are variations on that theme, so you don't have to have the pin. Both this company and others do solutions where you have implantable devices now, where you have something like this, which is underneath the skin, and then your hearing aid would look something like this. And so what you have is an intact skin solution, so there's nothing sticking through the skin, and it connects with a magnet, like that.
Through the skin?
Yeah, so on top. So what will happen is this device will just sit up above the ear, behind the ear like that, connect with a magnet, and so you could take it off to shower. It has a little device that you can swim with it, but it's nice and light, it's cosmetically appealing. You can put it under your hair, you won't even see it. It doesn't look like a hearing aid. This solves many solutions with outer and middle ear conductive problems. The other form of hearing loss, which I touched on earlier, if we're looking at an inner ear problem with a hair cell, that would be referred to as a sensory neural hearing loss. So there's a problem with the nerves or the hair cells is a sensory problem. But what if you have a problem with both? So now you have a problem with the middle ear bones, for example, and you've got an inner ear problem. So that's what we call a mixed hearing loss. So then we have a middle ear implant. Now this is what the middle ear implant will look like. And at the end of this little device is a tiny little weight. It's called a floating mass transducer. Now this is just to show you here on this little paper, these are real little bones. This is the hammer and that is the anvil, just to scale. And so this is a scale model of what the hammer and anvil look like. And that little floating mass transducer, represented by this little weight here, that can be attached via these little clips, and there are various different shapes of clips, to one of the little middle ear bones. And now you can transfer the sound onto one or more of these little bones into the inner ear. And again, the external processor looks exactly the same. And then we come to the inner ear. And here, this is the solution for the child that is born without hearing loss, and maybe born with a hair cell problem where it's not able to transfer or translate the vibration information into electrical information, or the older patient who has now lost so many hair cells that they've lost the clarity, the patient that has lost too many keys that it doesn't matter how hard you play, you still won't get the clarity. So these are all the internal devices. There's implanted underneath the skin, and there's an electrode that is placed into the cochlea, the human cochlea, inside here, that is lined up along those keys of the piano. But what happens now is that the electrical stimulation can bypass the hair cells and stimulate the nerve directly inside the cochlea and play the wires, as it were, of the piano directly.
So doctor, what advice can you give to people, either young or old, that are really not admitting to the fact that they are losing their hearing?
Sure. I think probably firstly, I'd just like to say that you're not alone, and don't worry about it. I think it's quite common. I think rather just go and have it checked up and find out what the problem is. Seek help. There are lots of friendly people to help you, and don't worry, there are lots of solutions for whichever problem you may have.
Well, thank you so much.
It's only a pleasure. Thank you for the opportunity.
Busamed Hillcrest Private Hospital is committed to promoting a safe, cost-efficient, and quality healthcare service to all patients. They strive to build a secure and integrated relationship between the staff, medical practitioners, and clients at Busamed Hillcrest Private Hospital. There is commitment to providing excellent care to all customers.